Welcome. I am Marcy Lawing, the nurse educator here at TriageLogic. In this video course, we will be covering steps 6 and 7 in our series of the 10 critical steps to a triage call. Step 6 will talk about choosing the right protocol, and step 7 helps you determine how to pick the right disposition to get your patient to the right level of care. Before we start, let's take a brief look back at steps 1 through 5. Step 1, this is where you introduce yourself. This lets the patient know who you are, your title, and the practice you are representing. Your tone should be professional and reassuring. Step 2 is about collecting demographic information. Making sure the patient's name is spelled correctly and the date of birth is entered correctly as well as the physician information. This will assure that this encounter will be sent to the correct doctor's office and filed in the correct patient chart. Step 3 is about collecting a brief past medical history. This information is critical in determining the safest disposition for your patient. Step 4, letting your patient talk. Give the patient 1 to 2 minutes to tell you what's going on. You can obtain valuable information about the patient and current symptoms. And step 5, documenting a brief yet complete assessment. Documenting is an essential part of any nurse's day. It is important to write down an accurate yet brief, concise recording of why the patient is calling. The process up to this point has been about gathering and verifying information to help the nurse complete her assessment. Based on the questions she is asked, the nurse should have a pretty good idea what the patient's main symptoms are and even the most acute symptom. She has used her critical thinking skills to prioritize her patient's symptoms from most acute to those that are probably non-serious in nature. Now it's time to use another tool familiar to nurses, the protocols. The purpose of using protocols is to classify and prioritize symptoms so the nurse can rule out the most emergent symptoms first. Protocols, when used properly, also standardize the triage process and maximize the chances the patient will reach the right level of care. Because no two patients present with the exact same symptoms, the nurse needs to take into consideration the patient's age, past medical history, including any chronic illnesses, and their severity. For example, a patient that is 21 years old, has no chronic illnesses, and is in excellent health with a moderate headache might not raise as many red flags as the 80-year-old patient with hypertension, a history of CVA, on multiple medications, who presents with the same headache. While both patients should be triaged using the headache protocol, and both patients should be considered emergent until ruled out, the nurse will ask different questions to each patient to determine the most appropriate protocol to use and disposition to reach. Once the nurse has selected the protocol she thinks she will be using, she should read the description or definition of that protocol. This step is important to further assure that the nurse is in the right place. To further emphasize this point, suppose your caller has told you she is experiencing arm pain after falling while walking her dog. If you simply looked up arm pain, which is her main complaint, you might see that traumatic injury is not covered in this guideline. By following the critical steps of a triage call, step 4 would guide the nurse to ask questions to complete an assessment of her patient's current symptoms. Questions should be focused on the patient's current complaint. Asking who, what, where, when, and why are a good start. It is while asking these questions that the nurse becomes aware of the fall resulting in the arm injury. Being thorough, she would also rule out any other injury related to the fall. This further assures that the nurse is using the most appropriate guideline to get her patient to the safest level of care. Here is one more example of how choosing the wrong protocol can be detrimental to your patient. You take a call from a 21-year-old female. She assumes, incorrectly, that you can see her office medical record and tells you she is having abdominal cramping that feels like a menstrual period, and asks if she can take ibuprofen. Without asking her last menstrual period or possibility of pregnancy, you go to the abdominal pain guideline and give care advice and an ibuprofen dose. Problem is, this patient is 26 weeks pregnant. Omitting one question can make a world of difference for two patients. In this case, the mama and her unborn baby. So what does a nurse do when a patient presents with multiple symptoms? How does she determine which protocol to use first? The best way is to ask herself, which symptom is most likely to send the patient to the emergency room first? Those symptoms that should come to mind first are the ABCs, the airway, breathing, and circulation symptoms,
If all symptoms are
along with
non-urgent,
any acute
the
neurosymptoms.
patient is the best source to ask this question.
Asking what symptom is bothering you the most will guide the nurse to the most appropriate protocol to use first. Keep in mind that in up to 10% of calls, you will need to use at least two protocols, such as the patient that presents with a cough and a rash. Choosing the most acute protocol first will save time and get your patient to the right level of care quicker. It's time to test your skills in choosing a protocol. I will briefly describe a scenario. Your job is to use all the steps you have learned so far and determine which protocol is most likely going to be the best one to triage your patient's symptoms. Here is your first scenario. A mother is calling for her 7-year-old daughter who came in this morning complaining of burning with urination. You quickly complete steps 1 and 2 of the 10 critical steps to a triage call. You introduce yourself, give your title, and which practice you are representing. You also confirm the patient information and verify the relationship to the caller and the patient. Now you are on to step 3, collecting a brief past medical history. Mom tells you this child is healthy. She has no chronic illnesses and no medication allergies. She's not taking any daily medications and has not been hospitalized or had any recent procedures. On to step 4, where you will ask the parent more specific questions about the child's current illness. During this step, you discover that the patient is afebrile, does not have any back, flank, or abdominal pain, there is no blood in the urine, and the child is otherwise acting normally. She is eating and drinking and playing within normal limits, and that the burning with urination started this morning. Moving along to step 6, based on all this information you have now, which protocol would you choose? If you said urinary pain, female, that's correct. Let's do a few more before moving on to step 7. Scenario number 2. A 55-year-old male is calling you to find out what he can do at home to treat his sore throat. Quickly, you cover steps 1 and 2. You introduce yourself and confirm the patient's demographic information. While reviewing his past medical history, you learn that he is taking a medication for hypertension. He's been on this medication for years, and his blood pressure normally runs 110/72 on his medication. He has no known drug allergies and exercises regularly. Now you're on to his current illness. Your assessment reveals that his sore throat started 3 days ago, and he's been taking Tylenol when needed and gargling with warm salt water 4 times a day. He tells you his sore throat is getting a little worse despite his home care measures. Along with the sore throat, he has clear nasal drainage and a slight non-productive cough that started at the same time as the sore throat. He is only coughing a few times a day and does not have any shortness of breath or chest pain. He is afebrile, able to swallow without difficulty, and is breathing normally. He is eating and drinking within normal limits, and he's able to do his activities of daily living, such as going to work and working in the yard. This patient is presenting with several symptoms. Based on the information you have collected, which protocol or protocols would you suspect you will need to use to fully assess your patient, and which protocol would you use first? Based on the information, the sore throat protocol should be used first because that is a symptom that is causing the most discomfort. The colds protocol would be secondary. I have one more for you. Suppose you took a call from an exhausted-sounding mother who tells you her 13-month-old child has a fever and has been a little fussier than normal. He doesn't want to go to bed and keeps waking up crying after 20 minutes or so. He has a runny nose and is tugging at his ears, but the mother tells you he always tugs at his ears when he's tired. With only this information, which protocol would you choose? Using symptom-based protocols, many nurses would be inclined to use the fever protocol, since that is the main symptom the mother is concerned about. Actually, the cold protocol would be the best choice, followed by the crying protocol. Using these protocols, the nurse can rule out symptoms such as difficulty breathing and inconsolable crying lasting hours, among other urgent symptoms. In protocols such as Barton-Schmidt's, the symptoms of fever is covered in almost all protocols. While choosing the right protocol is important to your final outcome, so is choosing the most appropriate disposition and getting your patient to the right level of care. They are a team. You must have both correct in order to help your patient. The triage nurse determines the proper level of care by asking the patient questions starting with those symptoms that would be life-threatening and working her way down by asking questions with progressively less severity until the patient and nurse agree on a disposition that most closely matches the symptoms the patient is experiencing at that time. A yes answer from the patient will indicate the disposition that is most appropriate for that patient. Ready for a pop quiz? Let's say your patient presents with a cough that triages out to home care and a rash that triages out to see their doctor in 24 hours. Which disposition would you give to your patient? Always go with the disposition with the highest acuity. In this case, the rash symptoms are more urgent than the cough. Okay, that was an easy one. Every nurse knows that not all patients will fit neatly into the same mold. This is true with dispositions also. Sometimes there isn't an exact disposition that feels appropriate for your patient. Here is a situation that is a little more complex. Your patient is a 75-year-old male. He is calling tonight because he slipped on a rug and fell forward, hitting his forehead. While there are no lacerations, there is a 2-inch bruise forming above his right eye. Quickly assuring your patient is stable, you go over steps 1 and 2 and move directly into step 4, momentarily skipping step 3, because you want to find out what happened, when, and if your patient has any symptoms that may send him directly to the emergency room. He seems stable. All neuro questions are negative. You go back to step 3 and discover he has a history of congestive heart failure, AFib, and diabetes. His medication list includes Coumadin. The appropriate protocol to use to assess your patient is the head injury protocol. With no apparent symptoms, one might be inclined to give a disposition of home care. The red flag here should be the patient's history of AFib and use of Coumadin. Overriding to a higher disposition based on the patient's medical history and nursing judgment would be the appropriate disposition. In cases such as these, the teletriage nurse can always override to a higher disposition, one that feels more appropriate for her particular caller. Gut instinct, nursing knowledge, and critical thinking skills will all play a role in determining if the chosen disposition is safe for the patient. The process is about delivering safe and efficient care to every patient, not about making all patients fit into the same mold. Sometimes getting your patient to the right level of care means doing what the patient requests, even if the protocol or disposition does not warrant it. Never argue. Always accommodate the patient. We have covered a lot of information about protocols and how to get your patient to the right level of care. Remember, protocols are one of many tools a telephone triage nurse will use to determine her patient's outcome, but it does not give the nurse all of the information she will need. She must still rely on her listening skills, communication skills, and nursing skills to ask the right questions, gather appropriate health information, and get an accurate description of the patient's condition or symptoms in order to determine which protocol to use and which disposition is safest for her patient. All of these steps must be done quickly and efficiently as to not cause your patient a delay of care. When in doubt, always do what is safest for your patient. Please check back soon for our next course where we'll cover steps 8, 9, and 10 and the 10 critical steps to a triage call. Please visit our Learning Center for more articles and videos. Feel free to leave comments and share this video with your colleagues.